Hey everybody, Dr. Rob here. Once again at Facebook Live, breakthroughs in the treatment of concussion. Concussion, without question, maybe the hottest topic, not in sports, but the hottest topic, conversation piece. Man, I'll tell you, I cannot remember too many people when I grew up X years ago getting a concussion. If they did, they only had one. I know they can't diagnose it then like they do now. There's a whole plethora of reasons why there's so many more concussions now than there are 20, 30, and 40 years ago. I can tell you this, if you receive a concussion, what I've noticed is it's without question deleterious to overall health, deleterious to your brain health, deleterious to your gut health, deleterious to overall health. Major issue. In addition, it's people don't know the proper treatment, and it's very hard to find a practitioner who's truly eclectic. So if anybody's ever had a concussion, if anybody has anybody that they know that's had a concussion, please share this information. This is going to be vital. I've been lecturing on this for the last 18 months. We've got some upcoming articles, possibly a book, hint, 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 can't tell you too much about that. But there's a lot of things in the frying pan, a lot of lectures coming up, and I can tell you, it really captivates the audience to talk about this. So concussion, how prominent it is. It's about 300,000 people go to the emergency room per year. Teenagers, actually, that go to the emergency room per year. If you have a concussion, one, you have a 1.5 chance of having a second concussion. If you have a second concussion, you have a 3 times the chance of having a third concussion. The most volume sport that has concussion, obviously, is American football. Actually, the highest rate of concussions per participant is cyclists. So now you have cyclists with the percentage and football with the volume. The one thing they both have in common is a helmet. So people wonder, wait a minute, they have a helmet, but they have a concussion, what's going on? The helmet protects against skull fracture, but it doesn't stop the concussion. Now, the big premise about the concussion, and I wish I had a model, we're working on getting a real model to really mimic the brain appropriately. Think of the brain, it's 3 pounds. It's the fattest organ in the body. It's soft jelly. It's not a liquid jelly like the discs that we did last week. It's a soft jelly, not a hard jelly. And you get hit, and the brain hits a spot, hits that hard skull, and whips back and forth. That whipping, unfortunately, enables brain tissue to rip apart. And that is the damage that's done inside a concussion. That whip is a key component. So with that being said, who's more susceptible, men or women, to concussions? Number one, women. Why are women more susceptible to concussions? Number one, they have a higher rate of reporting injuries for whatever reason. Number two, their neck muscles aren't nearly as strong as men. Upper body muscle mass not quite as strong as men, so their head whips back and forth in a more violent manner, leading to ripping. Women's brains can rip up to about 50% in a concussion. That's going to really take a long time to heal. And thirdly, something called the withdrawal hypothesis. The withdrawal hypothesis is very simple in that when a woman gets her head hit, the pituitary gland shuts off and doesn't allow estrogen or progesterone to be produced. So in the last 2 weeks of their proposed cycle, progesterone is quite high. When progesterone's high, progesterone has a cooling, calming effect, healing effect, if you will, to the brain. When they get hit like that, that withdrawal hypothesis shuts off the progesterone and they're not able to recover. So women are more susceptible to men. So much more that there's been studies that have shown that they have twice the recovery time that men do. So what other sports are people involved in that lead down the road of concussion? Soccer. So those who head the ball in soccer have 3 times the incidence of concussions than those who don't. Those who run into somebody or fall in the grass have a 6 times the incidence rate of concussion. So symptoms of concussion, real simply, fogginess, loss of cognition, nausea, visual loss, loss of memory, IQ, fatigue, and the like. In addition, there's 3 grades of concussion. Grade 1, very simply, is that you have symptoms, no loss of consciousness, and you have symptoms for 15 minutes or less. Grade 2 is no loss of consciousness and you have symptoms for over 15 minutes. And finally, grade 3, you have a loss of consciousness. Grade 3 is only about 10% of the time. We always look at people and we're always looking at the guy or gal getting knocked out, laid out, but that's only about 1 in 10, as I just said earlier. So those are the 3 grades. Interesting. Parents, please make note. When surveyed, we found out that, and this is documented in specific literature, we have found out that the parents actually don't know how to ascertain the concussion and what to do. So when I talk about the breakthroughs in the treatment of it, please make some careful notes. Obviously, we want everybody active. Believe it or not, the biggest takeaway and mistake in concussion is everybody says, let's rest. That has been disproven. Beeping red light. That has been disproven. Rest is not the answer. Rest from contact. You got to get them up and you got to get them exercising. You got to get them exercising in the first week. And the reason that the exercise is so important, exercise helps something called BDNF. That's brain-derived neurotrophic factor. Brain-derived neurotrophic factor is a protein enzyme that's in the brain that helps brain nerves heal. It's called neurogenesis. That is a breakthrough concept. I mean, I've heard Dr. Perlmutter years and years ago, who's maybe the forerunner in functional medicine as a neurologist, simply say when he went to med school, we didn't know that brain cells could recover. Shocking as it may seem. We only came to that realization 3 or 4 years ago. We call that neurogenesis, the genesis of the nerves. BDNF, brain-derived neurotrophic factor, are key components. A lot of articles that I've written out there on specific items to help heal and stimulate BDNF. So brain-derived neurotrophic factors help nerves grow. They allow dendrites. They allow for plasticity and the like. BDNF is a key component. Anybody who's interested in learning some ways on how to stimulate BDNF nutritionally, please just Google me, look up concussion. It's called Feed the Concussion. I've had about 4 articles on that. So now that we move into that, what are their treatment protocols? Excuse me. Remember, I'm not using a teleprompter, so sometimes I got to go extemporaneous. The test, it's called an impact test. And so I didn't have to ask John this time. So it's an impact pediatric test. So those are the tests. They're standard. Forbes magazine, August 24th, 2016, said those are the standard tests. All the states and the local high schools have them. They're a standard of coordination. So let's talk about treatment. I've got 5 concepts on what we do to treatment. We want to treat the patients. 1, musculoskeletally. 2, we want to do proprioception. 3, we want to do gaze stabilization. 4, we want to use laser. And 5, we want to have nutritional support. Musculoskeletally, yes, you want to go to a chiropractor or someone who understands manual therapy. The literature shows that it's fabulous. Soft tissue work, thoracic adjustment, and any kind of musculoskeletal rehab. Which muscles should be pointed at releasing and aiding and helping people with a concussion? Well, the data's in without question. It's the rectus capitis posterior minor. It's one of the occipital triangle muscles, one of 3. John just looked at me, but there's one of 3. So it's the rectus capitis posterior minor. So if you're a soft tissue person, dig in with your, no pun intended, with your active release or any myofascial release. Big shout out to my guys at Factor. Use the Factor tool real lightly in the occipital ridge. Work that posterior capitis minor. Great choice. So people say, well, if it's a triangle, there's 3 other muscles. Yes, the other 2 muscles do not originate on the occipital, insert and originate on the occipital ridge. They actually insert and originate on the dura, and within the dura it has a cerebrospinal fluid effect, which is a little different. So that is the one muscle that you want to take care of. Proprioception. Proprioception is your balance between your nervous system and your muscular system. It is a key component. Data research studies have shown that college athletes, after concussion, they go back to playing, have a 4-time incidence of injuring their lower extremities, ankle sprain, knee, hip, and the like, because their proprioception, their coordination, is just not working well. It's knocked off. We always know after injury, altered motor control, your inability to ascertain feed in your brain is damaged. Well, the brain is the main center in your body. So with that being said, proprioception, your balance in space between your nervous and your muscular system, is a key component. So proprioceptive training, great idea. Standing on one leg, you guys can't see that here. any kind of proprioceptive training, retraining your balance. Gaze stabilization. There was just a study that I read last night that just came out that gaze stabilization for 24 to 48 hours is a key component after injury. Unilateral gaze stabilization, getting visualization. They found out that you lose your gaze stabilization 24 to 48 hours after concussion. A key element, gaze stabilization, gaze stabilization. Big shout out to my web exercise friends. They've got 6 exercises pointed at gaze stabilization. I think everybody should start to use. I'm sure they'd be happy. I'd be happy to put that up on my an upcoming blog on concussion. Laser. The laser I love to use is the Zirconia low-level laser, FDA cleared for decreased pain and increased range of motion. My choice for laser therapy for concussion is the FX635. It's gothic. When you see the patient sits, you put it on their head. Why laser therapy? Well, literature has shown that the 635 wavelength has been shown to decrease cytokines, which are inflammatory markers that hit receptor sites that cause inflammation, NF-kappa B. In addition, they stop the laser therapy, the light, which is based on Einstein's law of physics. They stop cell death. It's also been shown to decrease all these inflammatory markers. The brain, which is the #1 mitochondrial area in your body, which makes ATP, the #1 thing that laser does is stimulate the efficient production of ATP, positive outcome, and decrease the amount of free radicals which cause oxidative stress, which injure the brain. So laser therapy, without question, is a forerunner in my treatment protocol to help people with concussion. The examples I've seen in my office have been fascinating and exciting. The big takeaway is when you hit your head, you'll also have a gut tie-in. Remember, your gut and your brain, I did it backwards, your brain and your gut are tied together. What are they tied together? Gut to the brain to the gut. Elevator up, elevator down. It's called the vagus nerve. Cranial nerve number 10. Parasympathetic nerve. Your vagus nerve, when it works appropriately, decreases inflammation, knocks down NF-kappa B. It works via cell membrane signals. The problem with the vagus nerve, after you get an injury, your vagus nerve doesn't work well. It's actually decreased. With that being said, the #1 new medical device out there are ways to stimulate the vagus nerve. When the vagus nerve is slowed down, did I do something wrong?
No, you're good.
Good. The vagus nerve, which is decreased after you hit your head, slows down. Guess what happens? Literature has shown that tight junctions occur in 6 hours. Brain cells die 6 hours. So your brain and your gut mimic. Here's the biggest thing. 3 hours after an injury, lipopolysaccharide, LPS, a gram-negative bacteria, which is in the outside, it's the outside membrane of the inner membrane, gets exposed. When LPS, this gram-negative bacteria, gets exposed, you have systemic inflammation. So you hit your head, you damage your gut, you have systemic inflammation. Literature has shown that if you laser the brain within the first 90 minutes in concussion, you can avoid that. That's probably not going to happen because you're not going to have access. But what you need to do is you need to laser the brain, laser the vagus nerve with the violet light for all 5 wavelengths, and you're going to get a great clinical outcome. So now we talk about brain to gut and gut to brain. In addition, let's talk about nutrition that will help heal the brain. So specific items like protein really help heal. Creatine has been shown to help with TBI and traumatic brain injury and traumatic brain injury post-concussion amnesia in the short term. Choline is great. It's very neuroprotective. Zinc is great for central nervous system enzymatic reactions. Vitamin D is neuroprotective. Magnesium L-threonate is the key component. It's the only form of magnesium that passes the blood-brain barrier. It goes into the cerebrospinal fluid and increases magnesium uptake by 15%. This was done in a study via MIT in September of 2016. In addition, magnesium L-threonate has shown to decrease aging in the brain from 9 to 14% and decrease amyloid plaquing, which leads to Alzheimer's, by 80%. So magnesium L-threonate is a major takeaway. In addition to that, glutathione. Glutathione, the body's #1 intracellular antioxidant. In addition, glutathione has been shown in a study in April of 2014 to decrease brain tissue damage by 70%. And finally, I don't want to forget about omega-3s, especially DHA. Helps with the cell membrane, helps with white brain matter, also helps with blood sugar. Alpha-lipoic acid is fabulous because it works with the water in the fat part of the cell. Alpha-lipoic acid helps with blood sugar because blood sugar dysregulation will adversely affect the brain. I told John, we used to say this in school. He said, yeah, we did the same thing, meant you crazy, you know, you damaged your brain. Well, actually, if you go like this, you damage your gut, you damage your brain. So that's a huge tie-in. So with that concussion nutrition protocol, you also want to do a gut protocol after, which goes to my famous 6R program, which we'll just gloss over a little bit with that 6R program. What you want to speak about is you want to remove. #1, you want to remove. So go gluten-free, guys. Everybody go gluten-free. You want to remove the bad bacteria from the damage here. Here's what you want to do. You want to remove using berberine, HCl. You want to use aromatic oils. 2, you want to replace. You want to replace with digestive enzymes and pancreatic enzymes. You want to re-inoculate the gut with a quality probiotic, and you want to regenerate, repair, and heal the gut. With that being said, the best way to do that is specific nutrients, medical foods. Big shout out to Metagenics, great medical food, Ultra Inflammix Plus 363, and Ultra GI Replenish. 2 great items with a plethora of ingredients that are going to help the gut repair and heal. You want to retain your gut health, and then of course, you want to retest and retain your gut health. So when you're looking at a concussion, some serious key components are you want to be able to test it, you want to get somebody treated, and you want to understand that it's not just here, it's here. So if you guys, please do me a favor, share the information. This is leading, cutting edge information. So many people have concussions. Let me give you a little case scenario. I had a 13-year-old climber, and they came in, and the 13-year-old climber had psoriasis, which we all know psoriasis is an autoimmune issue, and that autoimmune issue comes from the gut. And one of the first questions I ask anybody is, have you ever had a concussion? Mom said he had 4. I said, did he get the psoriasis before or after the concussion? She said it happened about 6 months after. Hit his head, damaged his gut. His gut gave him an autoimmune issue, which was psoriasis. We treated the brain, we treated the gut. His balance got better, his performance got better, his psoriasis went away. Understand, you never treat a symptom, you always treat systems. That's what functional medicine is, and that's how you get to root cause resolution, and that's how you help people heal. Concussion is a major topic, it's a major question. Please share this information. John, what questions do you have?
2 questions. First one, you mentioned earlier, time of concussion, you go to the emergency room. Is that always the best bet, or?
I think it's a great bet. You go to the emergency room, make sure you don't have a bleed, make sure nothing's fractured, then give me a call.
Okay, and the second one, are all concussions created equal? Do those protocols go across the board?
No, unfortunately, you know, all cars aren't equal and all concussions aren't equal. The recovery will be a different time frame. Obviously, there's some tremendous TBIs, but as far as concussions, I follow a similar protocol. It's just a question of the time according to grade 1, grade 2, grade 3, and the time. So if you had a concussion 12 years ago, you still need to get treated. If you had a concussion 12 minutes ago, jump on it so you don't have the adverse effect. So many of my patients had a concussion 15, 20 years ago, and since have developed food insensitivities because their gut has been compromised, lack of proprioception, inability to perform in the gym, etc., etc.
All good. Where can people find you?
They can find me at 311 North Street, White Plains, New York, 914-287-6464. Share this, like this. Always yours in Health, Dr. Rob.